Hello everyone, myself Vaishnavi Bhute and I am second MBBS student, and today we are going to study about management of common poisoning, snake bites and sting. First we will be discussing about poisoning. So what actually poisoning is? Poisoning is a lethal disruption of body's physiological mechanism by the induction of exogenic, biological and chemical agent through swallowing, inhaling, touching or injecting various drugs. Let's see the management of poisoning. So there are 4 steps in the management of poisoning. First, stop the source of poison. The patient should be shifted away from the source of poison. Second, limit the absorption of poisoning. This depends on the route of entry. If taken orally, vomiting may be induced or stomach wash may be given to prevent further absorption of poison. Third therapy, that is supportive therapy, and it includes A, B, C, airways, breathing, circulation. First, airway should be cleared of any mucus by suction to clear the air passage if needed. Second, if breathing is depressed, artificial ventilation should be given and here oxygen may be needed. Third, circulation. Circulatory status should be assessed by the pulse rate, blood pressure and urine output. Fourth, if the patient is in the coma, nothing should be given orally. Fourth therapy, that is specific therapy, and here you can see the list of specific therapy. For belladonna poisoning, physostigmine 1 to 3 mg given subcutaneously. For paracetamol poisoning, N-acetylcysteine should be given. For methanol poisoning, fomepizole should be given. For organophosphate poisoning, atropine is the best antidote. For iron poisoning, deferoxamine should be given. For carbon monoxide poisoning, oxygen should be given. For morphine poisoning, naloxone is the best antidote. For ethylene glycol poisoning, fomepizole should be given. And lastly, for salicylate poisoning, IV fluid with the sodium, potassium, hydrogen carbonate along with the glucose is given as a specific therapy. Coming towards the snake bite, snake bites are very common in India. India called the snake bite capital of the world. There are 4 major snake species in India: Indian cobra, common krait, Ussel's viper, soft-scaled viper, and the toxic principles in the snake venom are glycopeptides and proteins. Let's see the manifestations of envenomation. So here we can see the 2 effects, local effects and systemic effects. So local effect includes oozing of blood, fang marks are visible, cellulitis and necrosis are appear. Along with that, ecchymosis and blisters are also appear. Second effect, that is the systemic effect, and it includes neuroparalytic. It has difficulty in swallowing, facial paralysis, difficulty in speaking and breathing, and weakness of limb and trunk muscle. Also, it has a vasculotoxic and hemotoxic effect. Let's see the pre-hospital measures. The patient should remain calm and reassure him. Then, immobilize the bitten limbs by using splinting the whole length using a stick. Then, the splinting bandages should not be tied. Lay the patient prone with the head turned to left to protect the airways, and lastly, immediately shift the patient to nearest hospital site. Let's see the treatment at the hospital site. First, local wound care. Wound is cleaned with the povidone iodine solution. Place an IV line and start dextrose saline infusion. Third, give morphine to relieve pain and anxiety. Fourth, provide ventilatory support through a mask or endotracheal tube. Then correct hypovolemia and infuse pressure agent. Sixth, fresh blood or frozen plasma infused to contract the coagulopathy. Antibiotic therapy should be given, and it includes gentamicin plus cephalosporin. 8, anti-snake venom therapy, which is the most important, and it is the life-saving measure. And lastly, neostigmine should be given for the cobra bite. Coming towards the scorpion stings, scorpion stinging incidents are highest in India. There are nearly 100 species of scorpions in India. Most common type is Indian scorpion species. Let's see the manifestations. It includes severe burning, radiating pain, single hole in the center of swollen area, localized sweating and paresthesia. Let's see the treatment of scorpion sting. First, site is washed with the potassium permanganate solution. Then prazosin 1 mg in adult should be given. Then scorpion antivenom serum, which is the most important treatment. Then correct dehydration by saline infusion. Opioid analgesic or diazepam should be injected to relieve the pain. And lastly, antibiotics is given as a supportive therapy. Coming towards the management of bee, wasp and hornet stings, first Clean the stigma area with dilute ammonium solution. Then apply cold compress or ice cubes wrapped in a cloth. Then apply hydrocortisone cream to reduce the redness, swelling and itching. Then the patient should be given paracetamol or ibuprofen to relieve the pain. And lastly, chlorpheniramine or loratadine is given as a antihistamine to hasten the resolution of swelling. Let's see the management of dog bite. First, local wound care. Second, antimicrobials, and it includes povidone iodine. Third, post-exposure prophylaxis of rabies, and it includes rabies vaccine. And lastly, infiltration of human or rabies immunoglobulins. Now proceed towards question answer series. So my first question is, which is not the treatment of bite cases? And your options are A. Local wound care, B. Antiviral, C. Prophylaxis of tetanus, D. Prophylaxis of rabies. And the correct answer is B. Antivirals. Second question is, which is the most lethal species of scorpion? And your options are A. Arizona bark scorpion, B. Emperor scorpion, C. Hottentotta tamulus, D. bark scorpion. So the correct answer is C. Hottentotta tamulus. Third question is, what is the antidote of morphine poisoning? And your options are A. Oxygen, B. Fomepizole, C. Naloxone, D. Atropine. And the correct answer is B. Fomepizole. Fourth question is, elapid or cobra crate venoms are? And your options are A. Vasculotoxic, B. Neurotoxic, C. Hemotoxic, and D. None of the above. And the correct answer is vasculotoxic, A. And my fifth question and the last question, that is, WHO had classified dog bite into, and your options are A. 2 category, B. 3 category, C. 4 category, D. 5 category, and the correct answer is B. 3 category. So this is all about my presentation. Thank you.